Lamar Productions presents Let's Talk 901. Focused on health and social concerns. Top doctors committed to infectious diseases. Doctors on the next level of education. Memphis, the medical home for top doctors. Next level research and technology. Renowned doctor and professor of medicine. Medical Class 901 with Dr. Animalu. Memphis, the heartbeat of 901.
Certified infectious disease, HIV specialist, and internal medicine physician. She is currently an associate professor at the College of Medicine Division of Infectious Disease at the University of Tennessee Science Center in Memphis. And she also is an infection attending physician for Methodist University Hospital in Memphis, where she also serves as the medical director of infectious disease and geographic medicine for Methodist Lubrana Healthcare Memphis. I know I threw a new term at most of you, geographic medicine, so I want you to go Google that and see all the work that this busy woman is doing. She is very, very busy here. And we are so proud to be able to have her on our show today. We wanted to make sure that you know that she is the recipient of the Healthcare Heroes Award in the community in the outreach category that's organized by the Memphis Business Journal. And she also had the 2020 award in volunteerism for community outreach by the American College of Physicians, the Tennessee chapter. She's very compassionate, and right now she's busy fighting this war against the rising rates of new cases of HIV among teenagers. And she said that she's going to churches and to schools and other organizations to make sure that these young people get the information that they need in order to be able to protect themselves. And by the way, we focus on young people, but hey, we old people need that information too.
I'm very honored to be here, and also Dr. Mr. Galloway, whom we've met before. He's a phenomenal man, and I'm so happy that we have him here with us today. So I'm going to start by sharing my screen. I'm going to talk about HIV, just the basic information that everyone should know that will help us understand what this infection is, what it stands for, how we can prevent this, and treatment modalities. And so I'm going to just talk briefly about the natural progression of HIV, start by saying what HIV is, or, we talk about HIV, we talk about AIDS. So HIV stands for human immunodeficiency virus, and this is the virus that causes the HIV infection. And I will talk about the progression and what it means. So this graph here is just showing what the natural progression of HIV is from the time of primary infection to the point where we call the clinical latency, where there's nothing going on, no signs, no symptoms, and to the point where it gets to AIDS. We all hear about it, say, hey, somebody has AIDS or what? What does AIDS mean? That's the advanced part of the HIV. So you have the acute infection, which is the very first the time of, somebody being infected. So acute infection stands for that time period where the infection is new, into the body and is spreading through the body and infecting the cells. Let's talk about how HIV actually works in the body. What does it do? HIV itself actually does not kill. What kills is that it destroys the body immune system. The immune system is that part of the body that helps us fight all sorts of infections and keeps us safe. So what this virus does is to attack your immune system, destroy your immune system, and therefore your body is no longer able to fight simple infections. And so that's kind of how it works, just to put it very, in a very simple manner. Then after that period of primary infection, which will last for a couple of weeks, then you go into what we call the latency period. In this period, there's nothing wrong with you. Like, you don't have any symptoms. You don't, there's no fever, headaches, this, that. There's absolutely nothing wrong with you. And so what happens is that you can actually have this infection and have no idea, like zero idea that you have this. The acute infection, you might have what we call like, flu-like symptoms. You might think you have the flu, you just don't feel well, maybe low-grade fever, mild sore throat, body aches, and you be like, maybe I walk too much, or I have a little flu, and then it goes away after a couple of days, and after that you're good, right? And so you go into the latency period where you have no symptoms. And this can last anywhere from 5 to 10 to 15 years, and for some people up to 20 years, where there's nothing wrong in terms of infections or anything. And then you get to that point where we call the end stage AIDS, the acquired immunodeficiency syndrome, which is the end part of HIV, where if you don't treat, then that person is going to die. So let's talk about the risk factors for HIV. The commonest will be through sexual intercourse, having vaginal or anal sex or any other forms of sex with someone who is HIV positive or whose HIV status you have no idea. Sharing needles or syringes, maybe using drugs, cocaine, heroin, or even some people that maybe have to take insulin from diabetes, and you share your needles. You can't share your needles with someone else. So that would be another common way to contract HIV. When exchanging sex for money or drugs, having other STDs, things like syphilis, gonorrhea can also predispose you to contracting HIV. Then if you have blood transfusions from a donor who has not been tested, this would be very rare here in the United States, simply because we screen the bloods that we donate. When people donate blood, they're screened for HIV as well as other blood-borne infections like hepatitis B, hepatitis C. So it's going to be very rare, but it's still possible in some developing parts of the world. Then you have what we call vertical transmission from mother to child. This is also rare, but you will see this in a woman, a pregnant woman who is HIV positive and probably did not know she was positive or did not seek antenatal care and therefore was never tested. And she passes it on to her unborn baby during the process of childbirth. Then for those of us that work in the medical field, occupational exposure or needle pricks injury, maybe trying to draw blood from somebody with, uncontrolled HIV, and you accidentally, have a needle prick or cut, for surgeons or something. So you could have that from occupational exposure. So is not transmitted. So I just kind of wanted to, some of the myths that is out there to say, hey, when you, kiss somebody, you can get HIV. No, or for, from saliva, from sharing dishes or, silverware, from tears, from sweat, shaking hands, through the air, sharing toilet seats. These are not ways you can get HIV. And I wanted to put it out there because sometimes people think, oh my God, I hug somebody or I shoot somebody's son with HIV and now I have HIV. No, that's not how it spreads. So I thought it was important to kind of dispel some of those myths. So very rare ways of HIV transmission, oral sex, again, occupational. We talked about that, biting and deep open mouth kisses, unless you have wounds, somebody's bleeding, you're bleeding. I mean, there has to be some kind of exchange of bodily fluids, blood or other ways for this to happen. So it's very rare to see that. So Ms. Bettina already, spoke about, HIV diagnosis in the US, in terms of race and ethnicity. And you can see here that Blacks or African Americans have the highest rate in the country. And this is followed by the Hispanic or Latino people. And this is really very dear to me because in clinical practice, this represents exactly what we see in the hospital setting. Then if you look at the HIV infection also amongst female adults and adolescents, you're also going to see that Black women are at the top. We have the highest rate in terms of race and ethnicity, and also followed by Hispanic and Latino women, and then the other races do fall behind. So look at that gap between the purple line on top, between the Black and African American women, as well as the rest of the races. So here again, basically talking about transmission of HIV. The highest rate, as was mentioned by Ms. Bettina, would be male-to-male sexual contact, and then heterosexual, that's male and female. But the highest will always is the male-to-male transmission. Then the perinatal HIV, where I had mentioned about passing this virus from a positive mother, a HIV positive mother, to the unborn baby, is also 65% of cases reported was seen in the Black or African American communities. So basically amongst our women and also our children. Gay and bisexual men are the population most affected by HIV, and also this is something that is also important to note. If you look at this chart, also this is all from the CDC. You will see here that even amongst this population, the highest percentage is also seen in the Black and African American community. So when you talk about the male-to-male sexual contact, also is also highest in our community, in the Black community. So let's talk about testing. So I had mentioned that that initial part, the acute HIV, and then the latency period, these are the periods that you don't even know you have any infection, right? So what do we do? How do I know? I myself, Dr. Animalu, now, how do I know that I don't have HIV, or the person next to me? Like, what do we do, right? So the recommendation by the CDC is that we start testing anyone between the ages of 13 and 64 for at least one time. So we will recommend or indicate testing if you have a new sexual partner. So before you become intimate with your partner, regardless of if it's male to male, female to female, male to female, whatever it is, it doesn't matter. But if you're going to go into a new relationship and that you anticipate you will be sexually active, it's important that you and your sexual partner get tested. Then if you have a partner who is HIV positive and you're not using any protection, you also need to get tested. Now we will talk about the treatment where if you're well controlled, then all that would not matter. But we're talking about if you did not know the HIV status of your partner, or if they are HIV positive, they're taking their medications and having remaining virally suppressed. These are very important facts. Then if you engage in high risk sexual behavior, if you have multiple sexual partners, if you're not using any kind of barrier protection, or anything that will put you at risk, again, engaging with people you don't know their status. So we always say, hey, what's your status? Are you tested? Then IV drug users, if you're using IV drugs, cocaine, heroin, whatever it is, shooting drugs and all that, is very, very important to know your status. And then if, of course, it's worse if you're sharing needles. So these are very, very important risk factors. And then pregnancy. For every pregnant woman, part of the antenatal care that a pregnant woman gets would be, to test for certain types of infection that would affect the baby, including HIV, syphilis, gonorrhea, chlamydia, hepatitis B, hepatitis C. These are all infections that you could transmit to the baby just directly from childbirth. So if a woman is going through antenatal care, the chances are that she's going to get tested. And if for any chance, the woman is pregnant, then the doctors are going to try to put her on some HIV medications to control that infection so that it's not passed on onto the innocent baby. So there are different types of HIV tests out there. The commonest one is going to be the blood test that that is done in your doctor's office. So if you go to any health fairs and stuff, then we have the saliva test that you can get off the shelves from Walmart or Walgreens. So I'm not going to go into the false positive or false negative test, but that can occur, but in very rare cases. This is something we can talk about another time. So what are the greatest challenges in HIV? Is getting tested. This is the most important thing in HIV. And I can't stress this enough because you can't treat what you don't know, right? And the only way for you to know is to get tested. So we're encouraging everyone. I know that I think in March there's going to be a health fair. Miss Bettina will talk about that a little bit more. You can go to the, if you live in the Memphis, greater Memphis area, you can go to your health department. If you live in Hernando, anywhere in Mississippi, you can go to your nearest health department and get tested for free. You can go to your doctor's office, or you could go to other places. The walk-in clinics, they have a Walgreens, but get tested, know your status, because you cannot do anything. You cannot save yourself. You cannot save your partner. You cannot live if you do not know your status. Are you positive? Are you negative? That's the question that matters the most, because that will determine which way to go. Then let's talk about stigma and discrimination. This is something Mr. Galloway is going to talk to us about, but this is really something, as somebody, as a physician that treats HIV, patients, this is something that really worries me to the depth of my core, because we tend to stigmatize HIV and tend to, kind of look down on people who are HIV positive, and that's part of the problem. HIV now is like a chronic illness. It's just like somebody with diabetes, with hypertension, with, heart failure, other things. You don't go around, snaring at somebody else or being like, oh, what did you do to get this infection? It could be me, it could be you, it could be anybody. And this stigmatization is worse in the Black and African American, community, and it comes to discrimination. And so this is something that we need to work together as a group, as a people, and understand, because if we understand what this infection is, then it will be less criticizing and other ways. So this is something that really bothers me, and we will talk about it a little bit more when Mr. Galloway talks to us. Another thing will be non-adherence to medication. So now let's say that somebody's HIV positive. What are we going to do, right? We will put you on medications immediately to get virally suppressed. What does this mean? It just means that we come to that point where the infection is controlled. It's very. Let me chime in here and just say something real quick, okay? There is no cure currently for HIV, but we can control it, okay? So it's not going to be like gonorrhea, chlamydia, where you take some antibiotics and it goes away. This is a virus that stays in the body for life. So right now, there's no vaccine, there's no medications that can cure HIV, but we have medications to keep it under check, and you can go by and live your normal life, in your normal, healthy life. So another thing that that kind of plagues us here would be non-adherence to medication. As long as you're taking your HIV medications, you are going to be fine. But if you take and you stop, you stop, or you decide, hey, I don't want to take this medication, then the infection is going to progress and progress to the point of AIDS, which is that end stage of HIV that we talked about. So what is stigma? I've talked about it a little bit. So it's a mark of disgrace associated with a particular circumstance, quality, or person. In this case, we're talking about HIV. And then, discrimination, when, you look at, based on perceivable characteristics that serve to basically distinguish people from other members of a society. So this is something that people believe that only certain groups of people can get HIV. Absolutely not. Anybody can. And I can't stress that enough. Anybody can contract HIV. And then making moral judgments about people who take steps to prevent HIV, or feeling that people deserve to get HIV because of their choices. This is absolutely wrong. And I cannot stress that enough. So these are some of the common examples of what HIV discrimination would look at. when people distance themselves from someone living with HIV, or socially isolating a member of the community because they are HIV positive. And this is disheartening on every level. But I do feel that this is, partly due to the fact that, we don't have that knowledge. One of my favorite passages in the Bible says, "My people perish for lack of knowledge." And I feel like that's what actually affects us, at this day and time, this age where we are, and all that, is that people actually do not understand this infection. You think by sitting next to somebody with HIV, you're going to contract the infection, or by kissing somebody, or hugging, or sharing, your basic utensils, that's your, fork, knife, and all that, you're going to get HIV. Absolutely not. So we need to educate ourselves more. So I am so happy that Ms. Bettina and her group, they are doing these things to share, heart disease, HIV, all these things that plague our communities. Is so important that we have the right information. There's so much misinformation out there. All right. So, what are the effects of HIV stigma and discrimination? Where does the stigma comes from? Back in the 80s, when HIV was new, and we had all these horrible stories about people. Things are completely different now, and the lack of information and awareness, and the outdated beliefs. They say, hey, if you get HIV, that's a death sentence. Absolutely not. It's not a death sentence. You would live your normal life if you do the right things, which would be taking your medications, living healthy, exercising, dieting, doing all the right things like everybody else. You will be just fine. So, but people don't think about the effects this have on other people. But again, we're going to address that with Mr. Galloway. All right. So, what can we do? Educate others about HIV. All right, which is what we're doing right now. So that's why I'm so honored to be part of this, because this is something I do on a daily basis, and I'm very passionate about that. And being around people with HIV and talking with them, it kills me to hear these are the things that they have to go through every single day. People looking down on them, or being judgmental, or being discriminated about. So the most important thing is what we're doing right now. Let's talk about it. Let's stop HIV together. You have to know your status to be tested, or to get on medications. So let's talk about treatment. This is what I was actually walk everybody through the process, and then we can get to the treatment part. So now let's say someone gets tested and your HIV is positive. The first thing is going to be, oh my God, people are going to freak out, right? Do not freak out. Help is there. There's treatment. This is not, the way it was in the 80s, where, there was nothing, or you have to take like 20 pills every day. Now there's so many medications available, all right? And we're able to get anybody who's HIV positive and put them on medications. There are different classes of HIV medications. We have, what we call the PIs, the non-NOx, the NOx. I'm not going to go into this. That's a little bit for the medical, professionals. But I want you all to know that we have different classes of HIV medications that we can put you on, or put, somebody on. The class that we use, the choice of medication depends on the risk factors, other comorbidities. Does that person have diabetes, hypertension? Just some medications that might work for certain a group of patients, and it will not work for the rest. What is your race? We have to do certain tests, especially for the African American communities, and see, hey, do you have what we call like G6PD deficiency and stuff like that. So there's a whole bunch of stuff that we as providers do behind the scenes to come up with the right regimen. And so what do we do? These days we have multiple medications that come like combined, 2-3 pills in one pill, 2-3 medications in one pill. So all you have to do is take one medication a day. And we want to start as soon as possible, right? Regardless of what your CD4 count is. What is CD4 count? This is the test that we do that tells us how much the virus has destroyed your immune system. So the CD4 is part of that immune system that helps us fight infection, right? And as I mentioned earlier, the infection works by destroying this immune system. So we check your CD4 count. That would tell us how much the infection has progressed and what we need to do. Sometimes we have to put, that person, if that person has AIDS, we have to put them on what we call opportunistic infection prophylaxis. And these are basically antibiotics we're going to put you on to protect you from contracting what we call opportunistic infections. These are infections that, under normal circumstances, your body can ward off, but when your immune system is low, then it becomes a problem. So we put you on these medications to protect you from contracting any of these other infections going around till your immune system is strong enough to fight for you, and then we get you off those medications. HIV medications is something you take for life, just like if you have hypertension, if you have diabetes, if you have heart failure, other medical conditions that you have to take your medications for the rest of your life. So that's kind of how HIV medication works. And then, medication compliance, I had talked about it earlier. You got to be on your medications and take it daily. Okay. And then we as healthcare providers will always monitor for side effects. So let's talk about PrEP. What is PrEP? This is the pre-exposure prophylaxis, and we tend to give this if somebody's high risk of contracting HIV. So let's say that you are in an intimate relationship with somebody who is HIV positive and is not uncontrolled, then you might want to get on PrEP. Your healthcare provider will be more than happy to put you on this medication. These are basically HIV medications that protects you from contracting the infection. Or if you are in a sexual relationship with somebody, you don't know their HIV status, they may or may not have HIV, they don't know, you might want to protect yourself by getting on PrEP. Other risk factors or other people that would benefit from this would be if you have multiple sex partners and you don't know with unknown HIV status. If you've had other STDs in the last 6 months, it kind of puts you at risk of contracting HIV. And then if you share your needles, if you're an IV drug user or other medical conditions that you have to inject medications and you share your needles, then you will be a candidate for PrEP. One important thing is that before you get on PrEP, you must be HIV negative. So if you come to the doctors and come and say, hey, Dr. Animalu, I think I have risk factors, I want to see if I can get on PrEP, the first thing I'm going to do would be to check your HIV status. If you're negative, then I can comfortably put you on PrEP. If you are at that point HIV positive, then we can't do PrEP anymore. I just have to put you on the full-blown medications for HIV to make sure it does not progress. Then post-exposure prophylaxis, this is what we do after a suspected exposure. So if you come to me and say, hey, Dr. Animalu, or you go to the nearest ER or to your doctor's office and say, hey, I feel like I may have been, exposed to HIV. Maybe I had sexual intercourse with somebody. I don't know their HIV status. Well, I'm going to be like, okay, I'm going to put you on PEP, which is the post-exposure prophylaxis. We normally do this for 28 days and keep testing to make sure you're negative. Or it could be a healthcare provider, myself included. Maybe there's a needle prick injury, and I don't know if the patient is HIV positive or negative, or you don't know the status. And then we're going to go ahead and put you on this medication, which is also a type of HIV medication, in an attempt to protect you from contracting this infection.
Thank you so much, Doctor.